treating patients for, all things sexual health, amongst others. So if you want to give a kind of brief background to your own experience and your own background and how you got to where you are.
Sure. So outside of medical school, it's interesting. My full bio is the reason I went into medicine was I had an experience. I was a stage 4 cancer survivor, sort of midlife, and so I decided to go to medical school actually at 45. And when I got out, my interest was in oncology, but I really soon figured out that it was a little bit too close to home with all my experiences that I went through with chemotherapy and just a lot of the emotional issues that go with that. And I was able to work in a clinic that focused on men's health. And what I found number one, it seemed to resonate with me. One of the things that I noticed was that it's an incredibly sensitive subject for men. So number one, just getting the courage to address an issue like erectile dysfunction or a host of other personal issues, medical issues, is tough. But then once you get there, it's having the right doctor to set the tone, to put patients at ease, and then really get to the root cause of what's going on and provide the best approach to dealing with these sensitive subjects. There's a number of clinics out there that are incredibly super high volume, there's not much time spent with the patient, and my job is really to spend enough time to figure out what's going on and really select the best route of therapy to help the patient.
And have you found since you started working in this field that people have become more open about having these conversations, or are they coming to you at an earlier point, or do you feel that there's kind of been a stagnation in that progress?
No, I think that it's gotten a little bit more open and a little bit easier. And the reason is we are right now, we are inundated with commercials on the radio for clinics with erectile dysfunction and for testosterone therapy, which is another hormone balancing for men, is another big part of what I do. So television commercials, and then there's a host of therapies out there that are being promoted. So I think with all that going on, as sensitive as it is, it's getting a little bit easier. And what we're finding also is that 50% of men, roughly 50% of men over the age of 40 are going to have some form, whether it's mild to severe, of erectile dysfunction as they age for a number of reasons. And so with that in mind, I think it's getting a little bit easier, but still when you get there, it's how the provider handles that is a big part of the issue.
And you touched on it a moment ago, but people coming in to see you for erectile dysfunction, there often is an underlying issue which is causing it, and it's maybe a larger health concern. How do you address that? Do you address it in your practice, or do you maybe at times refer patients out to other specialists to help you out, or how does that process work for you in your practice?
Right, that's a great question. So the most important thing is really having taken the time to with an intake to drill down to get to the root cause, right? And so there's a number of different things that can cause. Number one, I always like to I look at it like the body is really a biologic machine, and think of your brain as a computer, and we've got to get a signal, right? Our penis. And so there's a number of things that can go awry in that. My background is in engineering. I was an aeronautical engineer for many years before I went into medicine. And so I think it works well to think very systematically, right? We as doctors, we're detectives. Our job is to ferret out all of the information that can help us really better understand. But the bottom line is, the big picture is there's a number of things. There's emotional issues, depression, anxiety that can cause problems, and we have got neurologic issues, right? With situations where we have nerve damage from everything from traumatic spinal injuries to surgeries in the groin area, like radical prostatectomies, right? Which can take an otherwise perfectly functioning erection or a penis and then render a man impotent as a result of not being able to get a signal to the penis. And then the real chronic things though start at the level of the penis, which is going to be a couple of things. Number one is chronic inflammation as a result of a host of different things. And this can range from what we have, an epidemic of diabetes and elevated blood sugar over long periods of time is inflammatory. Inflammation leads to atherosclerosis and plaquing. And now suddenly we can't get our nitric oxide to function properly, and we can't get vasodilation as a result of the stiffening of vessels that go on. So an inflammation can come from the diabetes, elevated blood pressure, hypertension, which stresses the vessels and causes damage. Smoking is another one. And then alcohol, long-term excessive use of alcohol, any inflammatory conditions in general are going to lead to a vascular damage. Yeah. And then leading up to that is we have to have, even if the vessels are functioning properly, we have to have enough of that amazing signaling compound nitric oxide on board in order to get the vessels to cooperate.
And you mentioned there, at the start, the 50% of men over 40 experience some level of erectile dysfunction. I suppose based on that data, what would you see as a preventative measure that you would recommend to any man as he kind of goes into his 40s and older to prevent these issues, like maybe some lifestyle changes, dietary changes, anything that you would just see as a given for any man?
Right. Great question. So, it's interesting because what I tell my patients, it's not, unless they've had a recent catastrophic event neurologically, it's not really about what's necessarily that's happening right now. It's really the last 10 plus years of what we've been doing to our body that's caused the damage, really the underlying damage to the tissues. And so with that said, certainly taking a good hard look at diet to see if in fact, number one, do we have a diet high in inflammatory foods, processed carbohydrates, sugars, even we're seeing now that high protein, animal protein content is inflammatory. So it's getting our arms around that, being very honest about what we do eat, and then taking a good look at diet modification. That's a long-term fix, right? That's, you can change your diet tomorrow if we've got underlying damage. It's not going to fix anything today, but it allows the environment. We reduce the inflammation. Now the body has a fighting chance on repair. And then the second thing is, now we remove the things that has been causing the damage, right? And then we look at what can we add that can help things function better, right? And so one of those things is I test all of my patients for nitric oxide. There are test strips that are available out there. I think I know your company has those. And a simple saliva test can basically at that point in time tell us where we are, right? Because it can change throughout the day depending on supplements we're taking and our diet. But if we can check a patient in the office based on where they are at that point in time on their diet leading up to that point, we can get a baseline of like, okay, here's where we are. And then there are some fantastic supplements, but adding the proper diet. So dark green leafy vegetables, foods high in nitrates, everything from dark green leafy vegetables. We know that beets are high in that. Even watermelon has some also. That's not something that you can eat in high quantities all the time. But all those dark green leafy vegetables and just getting the right foods go a long way in addition to supplementation.
Yeah, and it sounds like the test strips are a component of, say, a patient evaluation or a patient intake that you would do in your practice. Is there any other, I suppose, steps that are just a given for all patients coming through as they start the process with your practice and with your team outside of nitric oxide testing?
Right. So, again, the thorough intake, nitric oxide testing, and then certainly important is a physical exam, right? So we want to certainly, we're going to check their blood pressure. We know that blood pressure, if they've had chronic hypertension, that can be leading to it. And again, if we can get the nitric oxide up, that goes a long way. And it's, as we know, that nitric oxide isn't just for erections, right? It helps with hypertension, brain function, getting proper oxygen to all parts of the body, right? So we're going to do our physical exam. We're going to check all the vitals. We're checking what I call, we're going to do a good thorough check of the plumbing, right? We're going to make sure that there's nothing structurally that's contributing to the erectile dysfunction. Guys, we come with the equipment, but we don't necessarily understand how it's fully operational, and so many cases, even basic hygiene isn't always one of those things that all guys understand. So, are they circumcised? Are they uncircumcised? Are there underlying pathologies that are going on that contribute? May not necessarily be the root cause, but are contributing. And then we're looking for things that like plaques, which can contribute to potential a bend or a kink, Peyronie's disease. And then also we're using, we can use ultrasound also to help measure blood flow to see what's going on.
And it seems like, looking at your website beforehand, you have a real range of treatments. So every issue that could occur, you have something to treat it. Do you find that the majority of patients that come to you, that there is nowadays a solution in your bag that you will be able to at least improve their outcomes?
That's another great question. And I would say for the most part, yes, but it boils down to patient's desires, because we have what we have a point solution, right? We have things independent of what the cause is. We have some things that can work on demand when we need it. For instance, the PD-5 inhibitors, right? The Viagra and the Cialises and the Levitras of the world, right? They don't fix anything. All they do is help the plumbing work better when we need it to, most of the time. And that's the key thing is that we find, depending on the severity of what's going on, these can work fantastic. There are some side effects that go with them, right? But the more dramatic or the severe the damage to the vessels, or if we've got nerve damage, we simply aren't getting a nerve impulse to the penis to create the nitric oxide to help to allow the PD-5 inhibitors to work, then we're not going to get good results. So yes, so we've got that. So, and then secondarily, if that doesn't work, one of the things that we can look at is we have something that's been out there for years, which is called Trimix, another pharmaceutical product that really has a phenomenal success rate, upwards of like 98%, which is fantastic. Again, if you're looking for a point solution to make things happen now, independent of what's going on, the root cause,
sure,
that can work. Now, the drawback on that is that you have to self-apply or administer an injection, a small, tiny injection to the penis when you want to get an erection. So, and the results are pretty quick, and depending on how well the doc dials in the medication, the right type of the strength and then the volume of medication plays a huge role. And then we get into the things that are really more what I would call repair. And that's when we get into the things like acoustic wave therapy or shock wave therapy. And studies have shown that depending again how serious the root cause, that can work quite well in conjunction with nitric oxide. There's a whole really it's not any one thing, it's really a multitude of things. And in anything I would do, really nitric oxide is a key supplement along with diet, trying to help the patient understand their dietary issues or lacking, and then really finding a good solution for adding nitric oxide where we can. So the acoustic wave therapy is another one that can work, along with even using what we call a VED, a vacuum erectile device, or otherwise known as a penis pump, right? So that can work adjunctive, not, again, the most desirable solution, because you've got to apply this device before every time you want to have sex. And
sure,
these are really more mechanical than they are natural.
So it sounds like in your approach, and if you were recommending to a patient looking for a practitioner, that it's, there definitely is immediate interventions, but the reality is that a long-term intervention is going to be the more sustainable and just the better for your health overall.
Yeah, that's correct. And again, a lot of it really just boils down to the patient, right? Sometimes they simply don't care about a long-term fix and solution. They want a point solution now. We get guys coming in who've had issues for years, or maybe they've been divorced for a while or haven't been dating, and suddenly the big date's coming up and they're in. I just need something right now. Right?
Yeah.
I don't care. I don't have time to wait to help the body repair itself and adding all these supplements. So it really depends on the patient, but yes, we have a now solution, and then we've got the bigger long-term solution, which is really dietary modifications, as well as adding in those nutrients and supplements that can really help the environment.
Yeah, and it might be the instant gratification urge that kind of got to this point in the first place. So it's probably a bigger issue we won't dive into right now. But so, you know, how we got connected obviously is through the nitric oxide area, but, you know, we learned then about your book. So tell us a bit more about that, and, you know, what brought you to write a book, and, you know, who your intended audience is and what you hope they will get from it.
Sure. Yeah. So the book, which actually, if everything goes right, is actually going to be published today.
Oh,
I just
nice.
got it, so I'm very excited about that. It's called The Man Plan: The Ultimate Guide to Erectile Dysfunction. So, you know, it's been focusing in men's health for years, and seeing, first of all, working at other clinics and seeing how things are done, and now having my own practice, and really my approach, which is really a much more comprehensive approach to finding root cause and working with the patient if they want to work on a long-term solution. Being able to provide them with all the right information is the big thing. So it's really helping a patient, number one, identify why this happened to them, right? Mm-hmm. So there's a lot of clinics out there. They're not bad clinics, but the focus is in just what can I do to help you get an erection today, and that's it. I don't have time to work with you on a long-term solution. So my goal is, with my background, is root cause, if we can find the root cause, and then put together a plan. And, you know, even a long-term comprehensive plan can include a short-term solution using the Viagra, the Cialis, or even the injections, right? So we've got the ability to get a better erection now while we're working on a longer term. But so that's one of the things. But the other thing is I address a lot of, in the beginning of the book, I address all the reasons why men need to address this. Everything from their spouse says it's okay that they're not getting erections, but even though they know deep down they wish they could. Mm-hmm. They have issues with premature ejaculation. They've been with examples of they've been maybe with one partner their whole life, and that's all they know is mm-hmm. having an orgasm within the first 30 seconds. Mm-hmm. Then suddenly maybe there's a divorce. They're now dating, and they're finding out that, wow, that isn't the norm, and I need to see what I can do about this. Or that there just certainly is hope out there if the PD5 inhibitors don't work, right? Yeah. And then it's really just, the whole thing is really, it's an educational process of helping the patient. Why did this happen to them, right? What's the history of what may have caused this? And then it's, what are the solutions out there, and is there a solution that best fits them? And really, in a way that they can relate to. It's not over-the-top medical jargon, but it's really written in a way that a patient can relate to.
Yeah, so it sounds like, not quite normalizing it, but normalizing the conversation. And, I think a lot of times right. people can end up on an island where they believe they are the only person affected by this. But, by breaking it down and being able to, identify the root cause, even in a book, they can then go to the doctor and have a much more educated conversation. And maybe it is the thing that encourages them to go and seek professional help. So that's, excited to see how it goes for you. And that's available, will it be through your own site or just on Amazon, or where are you publishing that?
Yeah, certainly it's going to be on Amazon, as well as certainly here in the office. and potentially some other sites also. But Amazon for sure, right out of the chute. Yeah.
Fantastic. And then if someone watches the video and I suppose wants to learn more about your practice, or potentially start a consultation with you, or even another practitioner that might have a question for you on your approach, is your own practice website the best place to get you, or is there a kind of a general email that they can reach out to?
Certainly, general email is thrivemedinfo@gmail.com.
Mm-hmm.
Our website is www.thrivemed.com. Are all great ways. And again, our phone number is 480-257-5022.
Perfect. Okay, well, when we publish the video, I'll include all that information in the video info, and people can reach out to you as needed. But I really appreciate you taking the time, and excited for the book to get published, and hopefully we'll be seeing plenty more of you in the medical space and the consumer space. And